Pharmaceutical and Healthcare Association of the Philippines says there is a temporary shortage of certain paracetamol brands in some areas, and they appeal to the public not to hoard medicine. With us now is Jannette Jakosalem from PHAP. She's also the managing director of Zuellig Pharma. Good morning, Jannette. Thank you for joining us. Ma'am, tell us, what is your reaction to reports of this shortage of paracetamol products? Can this really be considered a shortage, or is it just a case of supply not reaching retail outlets? What's causing this?
Good morning, Ria. Thank you for inviting me here in your show. Yes, what we're observing today is an out-of-stock situation on certain areas with specific branches of drugstores and of specific brands. I think in general, Filipinos prefer or are used to certain brands of medicines that they've been buying, and that's where the shortage or the out-of-stock situation is happening.
Okay, so medyo malakas yung brand loyalty ng mga Pinoy minsan, no? So what are the alternatives that consumers can buy in the absence of certain brands?
There are a lot of other different branded generics. Paracetamol, analgesics, these are already very popular medicines. And if you go to the FDA website, you will actually see 1,000 different brands already of analgesics. The option would be to ask the pharmacist for a different available brand, and also to consult with the doctor so that the doctor is able to provide the patient really the right medicine, the right dosage, and the right advice.
All right, we know that with an increase in demand is a possible increase in prices. Is anything being done to be sure that prices of these medicines don't spike during this period?
Yes, we can assure you that for the members of PHAP, we will not be increasing prices on account of the current situation. It's already been tested even during the time of COVID. Our organization is composed of very highly ethical members. Besides, the pricing is usually dictated by regional offices, and it takes a long process for prices to be increased and determined. So you can be assured that for the members of PHAP, there will be no price increases on account of the current situation.
Right, Jannette, we also understand that PHAP is closely coordinating with the government to ensure a steady supply of medicines amid the threat of the more transmissible Omicron variant. When do you think supply will normalize?
Well, when demand stabilizes and we're able to properly plan the supply chain around the manufacturing of the medicines, then that's when supply usually also stabilizes. But as we speak, Ria, the organization and its members are already exerting extra efforts to make sure that demand for paracetamols in the Philippines specifically will be met. In fact, some of them are already looking at airlifting from different parts of the world where they're able to source the medicines.
All right, thank you for that. We appreciate your time, Jannette Jakosalem from the Pharmaceutical and Healthcare Association of the Philippines.